some of the other initiatives you're doing as you transition to value-based care. One of the things that a lot of health systems experience once that implementation starts is they see their revenue drop. And oftentimes if they're publicly traded, their shareholders weren't adequately prepared for that's the natural evolution of what happens. And having worked in California and grown up with Providence, you've dealt with risk-based reimbursement for a long time. So this is nothing new to you, but it is new to so many people. So how have you, A, gone through that process with your management team, and B, made sure the communication prepared everybody to understand what they could expect as you transitioned into value-based care?
Yeah, several things. Number one, it's an imperative to engage the doctors early on, particularly the primary care docs, with regard to what it means, from a value-based care perspective, what it means to the networks that we create that they would refer into. So really engaging them on the front end. And we have many examples where we went down the path of creating a value-based relationship and didn't do that, and to a T they fail.
Sure.
And so we've really made that number one. And so one of the things we've done with our physician enterprise or medical groups is we've created governance structures in every one of our markets. So there's a single structure for all of California, single structure for Oregon, et cetera, and a subcommittee of the corporate board that is a group of physicians, and they're dedicated to this. So they're dedicated to comp models, they're dedicated to value-based contracts, they're dedicated to reducing physician burnout, and dedicated to serving more people and creating access, particularly for the poor and vulnerable. We also put a stake in the ground that we would never move a medical group to value-based care, capitation managed care, whatever you want to call it, until they got to the point where 30% of the business could be shifted to that. And our experiences, whether it be the Heritage Medical Group that we have here in Orange County, which is really a phenomenally performing organization, FACE and the San Fernando Valley, or our entire delivery system, which is an entirely value-based model in Portland. So that is what we put the stake in the ground. And then what we've done is taken from whether it be FACE, Heritage, our health plan, and come up with the best practices as it relates to for the physician to be managing the patients. And also we're using a lot of outside data. So there's a company called Roadmap, which allows us to really go in and look at in great detail where every physician in every community we serve is performing on a scale of 1 to 5. And we identified once they get below 2.75, they're ready to be able to be part of our value-based care network. So we've taken experiences, taken data, and picked a goal that we felt was realistic. And we're really excited about it. Today we vary from 0 in Anchorage, Alaska to 70% in parts of Orange County. And the ones that are at 70%, the Heritage Medical Group Fullerton is remarkable. I mean, they have incredible physician satisfaction, incredible patient satisfaction. They're making money on primary care. Their value-based contracts have surpluses. They have the lowest physician burnout in the organization as well. And one of the other things that we're doing related to that was that we've created this culture. It's called Own It. It was actually built out of the Heritage Medical Group that really brings all of our physicians together to own it with their caregivers, own it with their patients and whatnot. So that's the methodical way that we're going about it. So far, so good.